Another example for you guys. Again, to learn, this patient was referred to me for endodontic retreatment of tooth number 30. According to the patient, the root canal was done about 2 years ago by his previous dentist, and he moved from Loma Linda to Sac and Sacramento, and his new dentist noticed this. Patient has some tenderness also associated with tooth number 30. So his dentist took a PA of the tooth and told him that the tooth had abscessed. So referred the patient to me. So take a look here. You can see composite buildup here, previous root canal. It looks like the dentist used Gates Glidden drills here. You can see the Coke bottle shape of the canals here, the preparation, and you can see a large periapical relucency. All right, let's look at another angulation. We always take multiple angulation PAs as well as a bite wing. Look at this angulation, and in this angulation you can see that this tooth actually has 4 canal systems, 2 mesials and 2 distals. And you can see how poorly this root canal was done. Looks like the mesial root has almost a 90-degree curvature, and this dentist just could not make that turn. Again, it all starts with not being able to. You get yourself into a situation like that when you don't know your limitations and you can't read x-rays. So if this dentist could read x-rays, for example, and had multiple angulation PAs, he could if he could read x-rays and to see what he was looking at, he could see the severe curvature of the mesial root, and perhaps maybe also if he knew his limitations, he could have hopefully referred this patient to an endodontist. Well, because of this dentist's lack of judgment, inability to be able to read x-rays and to see what he was looking at, and lack of knowledge, now this poor patient has to suffer. And that's what we have. So this dentist could not make the turn, so very likely didn't use a rubber dam. Again, I wasn't there to see if he used a rubber dam or not, but usually when I see root canals like that, I know that because I know that very likely this dentist didn't use a rubber dam, didn't follow the fundamentals of endodontics. And that's what you get when you don't use the fundamentals of endodontics. You can't read x-rays, you don't know your limitation and all that stuff. The outcome is this will be the outcome. And now, of course, this patient has an infection, an abscess tooth, and he paid for the root canal and all that stuff. And now, of course, this root canal will have to be redone. And this is how I discuss things with the patient. I say, you have an abscess tooth, you have an infection. Looks like there's a severe curvature of the roots. Looks like very likely there are blockages here, and you have two options. I tell the patient 2 choices with this tooth. One, and you need to decide. I'm not going to make the decision for you. One option is to try to see if it can save the tooth, but I can't guarantee anything. I can't promise anything. What I can guarantee and promise is that I'll do my best, but the rest I can't guarantee. I can't tell you with 100%. I can't give you a 100% guarantee that redoing the root canal will take care of the infection. So one option is to try to see if it can save the tooth. We'll redo the root canal and see what happens in 6 months. Come back and see me in 6 months after I've redone the root canal. We're going to take some radiographs of the tooth. We're going to put them next to each other, and we're going to assess this dark shadow. If this dark shadow has gotten smaller, that's a great sign. That means that the infection is gone and your body is regrowing and regenerating bone. But if this dark shadow has gotten larger, then we know what we didn't work. Then you have to pull the tooth, extract the tooth. And I always go over the option of extraction with them as alternative to redoing the root canal. So I tell them the second option would be that you say, forget it. I don't want to redo this root canal because you can't give me a guarantee and all that stuff. I already paid for the root canal. I don't want to pay for it again, or whatever reason you have. The patient, I tell the patient, whatever reason you might have, you don't have to explain that to me. The other option is you just say, forget it. I'm just going to have my dentist pull the tooth, or I'm going to go see an oral surgeon and have the oral surgeon pull the tooth, extract the tooth. So I discuss all of that with the patient. And in this case, this patient was young, in his 20s, and he said, forget it. I don't want to lose this tooth at this time. I know you can't guarantee, you can't promise me anything, you can't guarantee 100% success. I want you to try. Do your best, try to see if we can save the tooth for you. If it works, great. If it doesn't work, then I'll pull the tooth. So I said, fine, as long as you understand as long as you can consent. Informed consent, that's what it's called, informed consent. So patient agreed, patient will come back, we'll reschedule the patient, he'll come back so we can work on this tooth and try to save it.